It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, thanks for joining us, folks. I'm Sam Lesante. You're watching The Sam Lesante Show. Great show for you today pertaining to your health. Now, today healthcare is fascinating. It's expensive. What if you do not have insurance? What if you're one of these people that have insurance that's inferior insurance? Well, today I'm at Volunteers in Medicine in Pottsville, in their Pottsville office. We're going to learn a lot about people that need health insurance or need health care and they don't have any money. This is the place they come. Joining me is their CEO, Bob Alonge. And Bob, when I found out when you were explaining this to me, I was fascinated because, been doing health shows for many, many years. And so Volunteers in Medicine. Okay, so our viewers have an understanding, particularly seniors. Well, this is for everybody, but I mean for the seniors. Tell me what Volunteers in Medicine's all about.
Well, it started out as a free medical clinic, probably approximately 30, 40 years ago in Hilton Head, South Carolina. And it was started by a doctor who was retiring, and he was moving to Hilton Head, and he found out in his community, amongst the people that he was living with and retiring there, that there were many people that didn't have health insurance, and he was astounded by this. And so he reached out to his fellow doctors and said, what can we do about this? So he decided to do something about it. And so he along with some legislators in his state, they actually changed the law to allow volunteer and retired doctors and nurses to participate in free medical clinics, and the federal government would pay their insurance for malpractice, which was what was holding a lot of people back from volunteering, because he saw the need and he tried to fill it. And so since that time, it has grown, and Volunteers in Medicine, as well as our organization that we fall under we're under program of the NAFC, which is a National Association of Free and Charitable Healthcare Clinics. And
when you say the word free,
yes,
okay, and you're talking about medical advice, and I don't have insurance, and I'm not feeling good, and I want to come, am I coming to you? Am I coming to a clinic that has qualified people?
Oh, absolutely.
Tell me about what happens when someone comes here, because it's like this is too good to be true. I don't have insurance, and I'm coming into Volunteers in Medicine, and they're going to take care of me, okay, for no cost. Tell me how that works.
Well, I'll tell you why I'm here to start out with. I'm here literally because of a free medical clinic. A little over 15 years ago, I was living in Western Massachusetts, and in a town of Great Barrington, Massachusetts, and my late wife twisted her ankle, and we stumbled into a Volunteers in Medicine clinic, and at the time I was between jobs, and I didn't have insurance for the first time in my life. It was probably only about a month that I didn't have insurance until I started my new job. And as they were taking care of her, they said, "Well, you're going to start a new job. How about you? Would you like a physical?" And so they proceeded to give me a physical, and as routinely, I was about 40 pounds heavier than I am right now. I was probably like a poster child for diabetes. Mm-hmm. And they looked at me and said, they pricked my finger, and lo and behold, my numbers were almost 600.
Oh.
Yeah, and so they proceeded to go into emergency mode and take care of me over the next couple of days, and proceeded to take care of me and give me literally the best care I ever had in my life.
Did you see doctors?
I was able to see doctors. I saw a nutritionist. I saw an optometrist. I got root canal. This is a larger Volunteers in Medicine in Great Barrington, Massachusetts.
No cost?
No cost, not a penny. Not a penny was asked of me. Donations, yeah, I threw in anything I could, because I knew the quality of care I was getting, and these were people that were volunteering their time, mostly retired doctors and nurses. That's the way most of the free medical clinics, larger medical clinics are paid positions, but that's a whole different animal. That's people that have been in existence for a long time, and have gotten the funding to pay people, but still, predominantly the staff is volunteers.
I just heard this morning coming down here, a good friend of mine, I don't want to mention his name, was telling me about a person who just passed in the last week or two from stage 4 lung cancer. And the person did not have insurance. So he was going somewhere, okay, where he wasn't getting, well, he thought he was getting care, but because he didn't have insurance, unfortunately, when he really got bad and he went and got into the hospital and got qualified people, they said you have stage 4 lung cancer. Now, if that person would have gone a year before that and would have had the proper health care, that person, I think, would still be alive today.
There's a great possibility, yeah.
Okay, so now what you're saying is, for those people out there, I want to make this perfectly clear, because this seems to be too good to be true sometimes, okay? I don't have insurance. I'm just saying, if a person does not have health insurance,
Yes.
and they don't know which area to go, okay? If they call, and put the number on the screen, my friends, and 570-623-1113, okay? I'm putting the number on the screen so you could call. So you're only talking about Schuylkill and Carbon County.
Yes.
Okay, so it doesn't apply to Luzerne County.
Well, this is the thing. When I was doing my research, one of the things I told you prior to us going on the air that I used to, as a minister, we used to help a lot of people with food pantries in 2 different counties, and so people would be coming from all around because they needed help with food insecurity. And one of the things that I could never do, even doing it there with the food pantries, I could never say no to someone. If people were traveling 30 miles to get food, my thought was they needed food, and the same thing with us. We say Schuylkill and Carbon County, but I can tell you that we would not turn someone away if they came from out of the county.
So, Bob, when you're looking at a person who's coming in, and they should come in, if they just want a general, they're not feeling good, okay? We got hit with COVID, we got hit with the flu. How do you handle that?
Well, they would come in and either see our nurse or our nurse practitioner, and they would be examined.
And you have them on staff?
Oh, we have them on staff, yes. We're here, our hours here in Pottsville, we're here Monday through Friday. We have a walk-in day on Tuesday from 9:30 to 6 o'clock. Without appointment, you could just walk in, and then Monday through Friday is by appointment, and we have a nurse practitioner that works with us here in Pottsville. The same thing up in Tamaqua. On Tuesdays and Wednesdays from 9 o'clock to 1 o'clock is our walk-in times. Without an appointment, you could walk in. And then the same thing with the rest of the week. Our nurse practitioner, David Kasprick, he sees people by appointment up there, including Saturdays. He's doing Saturday hours.
These are all
right
qualified people.
These are all qualified. We have a nurse that works with David up there, and David's a nurse practitioner, and he's been practicing for over 30 years, as well as our nurse practitioner here over 40 years, I think. She's 83 or 84 years old, and she's still going strong.
And there's no charge?
No charge. If you have no insurance, there is no charge.
And even if they have to go, if the nurse practitioner says, look, you need an X-ray, or you need a CAT scan, or you need an MRI, how does that work?
Well, that we have help with. We've been in partnership with the Primary Health Network. They're in Minersville. And the Primary Health Network is what is called a federally qualified health center. A federally qualified health center is very much like a free clinic, but they have resources because they are funded by the federal government. and they have larger staff over in Minersville, and they're able to make referrals for more specific illnesses and treatment that we don't do here. So we work collaboratively. So if that cancer patient came in here and our nurse practitioner diagnosed this person, we probably would make a referral to Primary Health Network, and they're able to do the same thing that we are. First thing that we would do and they would do is see if we can get this person health insurance. When people walk in here, we're not a long-term clinic for the most part. We can be, but we're not. And we don't do more specific and health care services like optometry or dentistry. So we refer out to people like Primary Health Network, where they can do the diagnostic testing.
Is this for free too?
They have a sliding fee over there, but it could be for as little as $1 or whatever they people are able to afford.
But at least
they can't refuse people either.
Yeah. But at least they're getting something and knowing what's wrong with them.
Yes.
Okay. Now, when you're thinking about insurance, you think, well, everybody has them. Some people do have them, and it's not only for poor people. Okay. This is for everybody, all right? But like you said, some people may have Medicare, but they don't have the supplemental, yes. All right? So that means they could only do so much because they're still going to get a fee. Mm-hmm. How does that work with you?
Well, people that do have insurance, we will see them. And
do you accept insurances?
Our nurse practitioners do. They are independent. They're independent. Besides their volunteer work with us, they are also independent contractors, and they do work besides their volunteer time with us. So they are able to see them and actually bill insurances if need be. It has nothing to do with volunteers in medicine. It's something that they do on the side of their work with us.
Okay.
So we do have the ability, and we also able to do home visits. No
charge.
If they have no insurance, then no charge. If they can bill, our nurses have the capacity to bill once again independently.
Okay. Are there certain qualifications you need to have before you accept me? For example, if I have a head cold, or if I'm not feeling good, and I just want a general checkup, and I need blood work done, etc., how does that work?
Well, again, you would come in and you would see our practitioners, and they would determine what you need, and they would determine the course of how to help you for the long run.
Okay, folks, I'm talking to Bob Alonge. Alonge.
You got it. Either way is right.
Okay, CEO for Volunteers in Medicine. It's interesting, for those of you who are not feeling well and you need some health care. Volunteers in Medicine, and the phone number is on the screen, 623-1113. They also have an office in Tamaqua, 229 West Broad Street in Tamaqua. You come back, we'll find out a little bit more. I know sometimes you're thinking this is too good to be true, but if you're not feeling well, I highly recommend you call that number, ask questions. It's no cost. We'll be back right after this. Well, welcome back to the Sam Lesante Show, folks, and thank you for making the Sam Lesante Show the #1 talk show in northeastern Pennsylvania. Now, that comes from the scientific poll from the Susquehanna Polling and Research. They were voted #1 in the country in polling, so we're very appreciative of that. Also, where can you watch us? Well, of course, you watch us. Some of you are watching us on Comcast 190 in the greater Pottsville area. In the greater Hazleton area, we are on channel 13 and 513, and in the Wilkes-Barre Mountaintop area, channel 92 every Saturday and Sunday from 7 to 11 p.m. and our YouTube channel. All of these shows are also on the website, so if you don't have cable, which I think you should, just go to our website. Now, where am I? I'm here in Pottsville. Volunteers in Medicine. What does that mean? Well, if you don't have health insurance, or if you have inferior health insurance, believe it or not, there's help there for you. There's no reason for you to be sick. There's no reason for you to get upset. I'm putting a number on the screen, 570-623-1113, and I'm talking to Bob Alonge, who is the CEO of Volunteers in Medicine. And please watch the show because we repeat this a number of times. He explained what Volunteers in Medicine is about. I don't want to go through that repeat because there's a lot to talk to you about. We're talking about, someone has to pay for all this free stuff. Okay, so where do you get the Mulietsky from? That's money.
It's a good question. We don't get a lot. I can tell you, my church is paying. They donate a lot. We do get some private donations, but not a lot. We're fortunate to have a great office here in this building owned by the city of Pottsville. We have a great rate for our office, and we don't have a lot of needs, but it doesn't mean that we don't have a lot of desires. And we could talk about that later on about what our plans are for the future. But we started off in our church basement, so we didn't have very much expenses there, and now we're here, and our overhead is low, but and all of our people are that are here are volunteers.
Can you assure me that when I come here for medical advice or a physical checkup or whatever, that I'm going to get, number one, a qualified person, number two, if I need a prescription, who's going to write that prescription for me, and it's not going to be like, one of these not so qualified healthcare person taking care of me? Can I feel comfortable?
Well, I certainly would hope so. I could tell you that I'm also a patient here. So I could speak to you as a CEO, and I could speak to you as a patient. I am in that category. My health care plan that I have, that I've been on for the last 6 months, is inferior. I did a Facebook, page the other day. I held up a bottle of medicine that my pharmacy wanted to charge me $125 for. I came here and I was able to get it for free. The nurse practitioners gave it to me because it was something that I needed. It was something that was in our pharmacy.
Now, this person can write prescriptions.
Yes, we have nurse practitioners in both Pottsville and Tamaqua, and they, both of them are over 30 years. Yeah. I think David's probably 35, and Sandy is over 40 years as a nurse practitioner. Sandy is also a doctor in medicine. And so they've been around a while, and we are so blessed to be able to have them working for us and volunteering their time for us. They are not enough. We need more. So if you're a nurse practitioner out there or a doctor that wants to volunteer for us, it would allow us to expand our time. We have limited hours here in Pottsville because of the availability of our nurses. We do not have enough.
Mm-hmm. So coming in, you're not feeling well, you don't have insurance, there's no reason for you to be sitting home sick. You have a person that can write a prescription. Now, from what you just told me, you just got many prescription drugs in. Okay, so if you have those drugs, you could give them, they'll be prescribed for no charge, right?
Yes. And if it's something that we do not have, then we can help them. We can write a prescription to them. And like myself, I use GoodRx for a lot of my needs, and it brings down across my one diabetes medication. I'm paying $35 from GoodRx, and it's probably over 1,000. 600 or something like that. So there are programs out there. Walmart has a $5 plan for a lot of people. A lot of drugs are covered under that. And in a perfect world, we'd actually be able to help them financially, but we're not there yet.
Well, I just want to also mention in Hazleton area, Heights Terrace Pharmacy also works very, very good with a lot of prescriptions. They've been, Heights Terrace Pharmacy has been around a long time, and they're out helping. Incidentally, who he's talking to is the real boss's wife. So just so you know, he's not talking to the wall. Yeah. Okay. Sometimes you are.
She's the voice in my ear over here.
Yeah. Sometimes you're talking to the wall. Okay. That's what my wife says. Are you talking to the wall? Getting back on course, this is
You're welcome to join us.
This is fascinating because we're talking about healthcare here, and we're talking about people that just cannot go and they can't afford it. And you're telling me, don't be concerned about that. If you're not feeling well, we have an opportunity to come here and get qualified help, okay? And if it has to go further, you have those opportunities of work, and you do have people working with you. Is that correct?
Yes.
Funding. Some people, are appreciative, and they don't have the fees, but they may give you a donation. Okay,
we will take it.
And I think that's important because there's some people that are very appreciative, and sometimes family members say, look, you took care of my mother, you took care of my brother, my sister, whatever, and some of them may say, here's a donation towards it. You don't ask for that, but it's good if you get it, correct?
It's always good if we get it. Yeah, someone just came in the other day and they wanted to give us more, and we said no. Whatever you give is fine.
Okay, so flu shots, COVID shots, immunizations. Okay, do you have them?
We have some. We do not have all of them, and this is something that I've been working on for a couple years. We're working with the Department of Public Health to try to be the place where people can come to here. We applied, and we're not quite there yet. I believe they're in the process of requalifying centers as we speak, and then we're on the list to get qualified so people, so that the state could work with us. Like I said, we're not there yet, but we do have the ability. Like we're doing Tdap immunizations right now, and we're providing them all throughout the week here, and these are booster shots, which includes tetanus. And they're available all throughout the week, and David is actually doing them on Saturdays in Tamaqua. And we're also offering them to the school districts too. We're reaching out to all the school districts in Schuylkill and Carbon County because 7th and 12th graders need boosters every 5 years. So we're reaching out and providing that to the schools right now too.
Okay, so there's a lot of times when someone's not feeling good, they come in for an initial check and they're getting prescriptions or whatever. What about follow-ups? How does that work?
We will follow them.
You got to come back in a month or 2 months, or the nurse practitioner should be able to tell you that I need to see you in a month. And what about all these tests that have to be taken? Blood work and the whole thing. I know I'm being redundant here, but I'm in my mind. I'm thinking all the things that are necessary for you to find out what exactly is going on with that person.
Well, as we grow up as a clinic, we'll be able to do that in-house. This is part of our 5-year plan that I think I've sent to you. As a CEO, my job is to always be looking into the future and to see what we can be doing better. And what we can be doing better is having the ability to do testing here on site rather than sending it out. So larger clinics have the ability to do that here. We are waiting on an ultrasound machine that is being donated to us. And David actually, Kaspic up in Tamaqua, he's actually trained to do that. So we're able to do some testing. We're able to do some rapid testing here in the office that they're qualified to do.
So let me ask you a question. I know we're running short on time. Okay, so you started in 2021, you said?
Yes.
Okay, so you've had literally hundreds of people that have come and used the services. Do you ever realize that if there was not a volunteer in medicine organization, how many of you people that have used this would be gone today if you didn't have the opportunity of having VMI, which we call volunteer medicine? So I applaud you and your team because I think from what I'm seeing here, you have saved hundreds of lives of people that are unfortunate, did not have the opportunity of having health insurance, and if they have Medicare, could not afford the second part. It's so gratifying to know that there's people like you that can help mostly my audience, which is a senior audience. So do not be ashamed. Do not be, if they've been around for a while. It's 570-623-11113. You got a minute left. Tell us what we need to know.
You're right about being ashamed. I mean, it's you need to know that we're here to help. I mean, my wife reminds me that I'm doing this because I'm paying it forward. I would not be here literally if it wasn't for volunteers in medicine, you know. So my job is to pay it forward and be with gratitude about the service that I got 15 years ago, and you know my job is to make sure that volunteers in medicine is here for many years in the future, and we need the help of the general public. And we need the help of businesses that are able to contribute to us to ensure that we can help more than 100 people or several hundred people. Schuylkill County alone is 15,000 people are uninsured. 15,000. So if we were doing our job, we would be serving at least 15,000 people a year, which is why I have to look ahead to the future about expansion.
Well, I'm hoping, I wish you the best. And my friends, if you do not have insurance, please, or under insurance, call them. The most you can do is get information. You know, hang in there. They're here to help you. And once again, it's 570-623-1113. Maybe down the road, we're going to do another show, and we're going to talk to some people that use Volunteers in America, Volunteers in Medicine. And they'll tell you for themselves, if they didn't have this organization, would they be around today? We don't know. See you next time.